As we age, our bodies go through significant changes that affect how we absorb and utilize nutrients, making it even more essential to pay attention to what we put into our bodies. Vitamins play a critical role in maintaining good health, especially for seniors who are often at risk of deficiencies due to changes in appetite, digestion, medication interactions, or limited exposure to sunlight and physical activity. However, not all vitamins are created equal, and while some can be incredibly beneficial, others can be unnecessary or even harmful if taken without proper guidance. So let's dive into a closer look at the best and worst vitamins for seniors, and why they matter so much at this stage of life. One of the most important vitamins for seniors is vitamin D. This fat-soluble vitamin helps the body absorb calcium and supports bone health. As people age, the skin's ability to synthesize vitamin D from sunlight decreases, and many older adults spend more time indoors. This often leads to a deficiency that can contribute to bone thinning, osteoporosis, and an increased risk of fractures. Supplementing with vitamin D3, the most effective form, can help maintain strong bones and support the immune system. It's especially crucial for seniors living in colder climates or those with limited sun exposure. Pairing vitamin D with calcium ensures that bones stay dense and strong, reducing the likelihood of fractures and mobility issues. Another vitamin that's highly beneficial for older adults is vitamin B12. This vitamin is essential for maintaining healthy nerve function, producing red blood cells, and supporting brain health. As people age, the stomach produces less hydrochloric acid, which is necessary to absorb B12 from food. This often leads to a deficiency that can manifest in symptoms like fatigue, memory problems, and even mood disturbances. In more severe cases, a lack of B12 can cause irreversible nerve damage. Supplementing with B12, especially in its methylcobalamin form, can help restore energy levels and protect cognitive health, which is a common concern among seniors. Folate, also known as vitamin B9, is another important nutrient for seniors, particularly when it comes to heart health and cognitive function. Folate helps regulate homocysteine levels, an amino acid in the blood that, when elevated, has been linked to an increased risk of heart disease and dementia. Many seniors don't get enough folate from their diet, especially if they don't eat a lot of leafy greens or fortified grains. A folate supplement, or getting enough through a well-balanced diet, can help reduce these risks. It's often included in B-complex supplements alongside other essential B vitamins like B6 and B12, creating a synergistic effect that supports overall energy, mood, and brain function. Vitamin C is another essential nutrient that supports immune health, wound healing, and acts as a powerful antioxidant. While most people get enough vitamin C from fruits and vegetables, some seniors may not consume enough fresh produce due to dental issues, limited appetite, or difficulty preparing meals. In such cases, a modest supplement can help. However, extremely high doses of vitamin C should be avoided as they can cause digestive issues like diarrhea or even kidney stones in susceptible individuals. A balanced intake is key, just enough to support immunity without overdoing it. Vitamin E also deserves attention. As an antioxidant, it helps protect cells from oxidative stress and supports skin, eye, and immune health. However, it's a double-edged sword for seniors. While small amounts are beneficial, high doses of vitamin E supplements have been associated with an increased risk of bleeding and even stroke, particularly when combined with blood-thinning medications. Seniors should be cautious and consult a healthcare provider before supplementing with vitamin E, especially if they're already taking anticoagulants or have a history of heart disease. Another vitamin that should be approached with caution is vitamin A. It's essential for vision, immune function, and skin health, but excessive intake, especially from supplements, can be toxic. Seniors are more sensitive to the effects of vitamin A toxicity, which can include liver damage, dizziness, nausea, and even increased risk of hip fractures. Most people get enough vitamin A from their diet, and the body can convert beta-carotene from fruits and vegetables into vitamin A safely. However, preformed vitamin A, which is found in many multivitamins, should be used sparingly, if at all, unless a deficiency has been diagnosed by a healthcare provider. Iron is another nutrient that deserves a balanced approach in older adults. While iron is crucial for producing red blood cells and preventing anemia, not all seniors need extra iron. In fact, too much iron can lead to a condition called hemochromatosis, where excess iron builds up in the body and can damage organs. Men and postmenopausal women are especially at risk for iron overload because they no longer lose blood regularly through menstruation. Unless blood tests indicate a deficiency, iron supplements should generally be avoided in seniors to prevent complications related to iron excess. One more vitamin that plays a vital role in senior health is vitamin K2. While vitamin K1 found in green leafy vegetables is important for blood clotting, K2 has been shown to support calcium metabolism and cardiovascular health. It helps direct calcium to the bones and teeth where it belongs and prevents it from being deposited in arteries, which could lead to calcification and heart disease. Many seniors are unfamiliar with vitamin K2, but it can be especially helpful in conjunction with vitamin D and calcium to ensure proper bone and arterial health. However, it should be used cautiously in people taking blood thinners like warfarin, as it can interfere with how these medications work. Magnesium, though technically a mineral and not a vitamin, often gets bundled into discussions of supplements for seniors, and for good reason. It supports muscle and nerve function, helps regulate blood sugar and blood pressure, and contributes to bone health. Many older adults don't get enough magnesium due to poor dietary intake, medication side effects, or chronic health conditions. A magnesium deficiency can result in muscle cramps, fatigue, irregular heartbeat, and increased anxiety. A gentle supplement such as magnesium glycinate or citrate can be a safe and effective way to restore levels, but it's always best to consult a healthcare provider to determine the appropriate dosage. Multivitamins, which combine many of these nutrients into one tablet, are popular among seniors, but they're not without drawbacks. While they can fill in some nutritional gaps, they often contain nutrients in amounts that are too low to be truly effective or too high to be safe, especially for older adults who are more sensitive to overdosing. Moreover, they can create a false sense of security, leading some to neglect a nutritious diet in favor of a daily pill. Ideally, seniors should get most of their vitamins and minerals from whole foods, using supplements only to target specific deficiencies or medical conditions under a healthcare provider's guidance. It's also important to consider how medications interact with vitamins. Many seniors are on multiple prescriptions, and some medications can interfere with nutrient absorption. For example, long-term use of proton pump inhibitors can reduce the absorption of B12 and magnesium, while diuretics can deplete potassium and magnesium. Understanding these interactions is crucial when considering supplementation. A pharmacist or doctor can help review all medications and recommend any necessary adjustments to diet or supplements to maintain optimal health. In conclusion, while certain vitamins like D, B12, folate, and K2 can significantly enhance the health and quality of life for seniors, others like vitamin A, vitamin E, and iron must be approached with caution due to the potential for toxicity or harmful interactions. The key is balance, awareness, and personalizing supplementation to meet individual needs based on diet, health status, and medical history. Seniors should always consult their healthcare providers before beginning any new supplement, even those marketed as natural or essential, because what works well for one person might be ineffective or even dangerous for another. Thoughtful, informed choices about vitamins can help older adults stay active, alert, and thriving well into their golden years.